Welcome back. Today on med school, we're going to talk about an intubation. In my training, almost all intubations were done with the endotracheal tube. Essentially, this tube is advanced through the vocal cords into the lungs to help you breathe and keep you safe during anesthesia. Recently, not real recent, we started using laryngeal mask airways. These are soft and pliable. These are advanced into the back of the throat. We actually inflate this balloon and find a way to keep you asleep during anesthesia without having to put a tube all the way down into the lungs. It's kind of new technology. Many people that are having short anesthesias, don't require a big surgery, will have this done. A laryngeal mask airway, we're going to show you how that's done today. Hello, welcome to medical school. Today we're going to show you what happens as you get put to sleep for anesthesia. Today we have a mannequin that we use as a model for this. And generally what happens is the patient is monitored and he's made sure that everything is safe, his heart rate, blood pressure. Then we'll essentially take a mask and give the patient oxygen. Get enough oxygen to his body so he's going to be able to maintain his respirations and maintain his heart functions. Once we do this, then you may see that the doctor will then put in an oral airway, such as this. What he's really trying to do is give himself a better airway, to have a clear, no obstructions, oxygen going right into the lungs with no difficulties at all. Subsequent to that, what you'll see is once the patient is comfortable and he's made sure that the patient's nice and asleep, he will insert the laryngeal mask airway. The laryngeal mask airway's got a soft area that can be inflated here to kind of seal the back of the throat. So let's see how that's done. Essentially, you just take it in this manner, you slide it right into this area, into the back of the throat. You will then seal that area as we mentioned earlier. We'll remove that, and then we'll check it. We'll go in here, place this right into this area, give the patient some oxygen, and as you can see here, the lungs are expanding very nicely. What you'll also see today is while this is being done, then the anesthesiologist wants to secure the airway so it doesn't move and doesn't accidentally come out. So he'll just put a small piece of tape in here, such as this. He will also secure the eyes to make sure that there's no difficulty with the eyes. As you're put to sleep, you no longer have any tearing. We want to avoid any kind of abrasions or problems with the eye. Then essentially what he'll do is take over the oxygen again, hook it up to an anesthesia machine, and that's how you do anesthesia. So at the end of the procedure, what he'll do is essentially go in and take out the tape again. As you would imagine, he would deflate the cuff, as we see here, and remove it. Again, take control of the airway until the patient wakes up, he's comfortable, and he'll go to the recovery room. This is what we call anesthesia with laryngeal mask airway. The other thing that you're probably more familiar with, and maybe you've seen on television or other places, is when we use a laryngoscope and a blade, and this blade has a nice little light here to allow you to see into the back of the throat. And in that kind of situation, what we will use is an actual endotracheal tube. It also has a cuff that will be filled with air to expand the cuff, and we'll show you kind of how that happens right in there. That's going to create a seal inside the trachea. We'll sit here, we'll take the laryngoscope, we'll place this in the back of the throat, and Terry will help us here a little bit and show us how that's done. We'll take this, advance it into the area. Again, refill the cuff. And once again, take over the breathing. Okay? We'll secure it like we did in the other one, and that's how it's done. To remove it, you'll see again, it's pretty much the opposite of what we did when we put it in. We'll just go in, remove the air from the cuff, pull this out gently. Again, we place the mask back on there, keep the patient comfortable and safe. So the reason for anesthesia, the reason for airway control, is for the patient's safety. As long as they have oxygen, they're going to do very well. As long as they have oxygen, the brain is going to do very well. They're going to wake up very nicely and comfortably and go back to their families. This has been Back to Medical School. Till we see you next time. I hope you enjoyed that med school segment. We'll be right back.